This gets more challenging the further down the line you are, so I'm really happy I'm not Kim. What wonderful speeches. Welcome to Torino or Torino. Oh, no. Sorry, wrong place. We know the Winter Olympics are going on, but I don't know if you know that there is a country that is not at the Winter Olympics this year, and that country is called status quo. They were very surprised and dismayed that their teams did not make it to the Games because, after all, they legislated, mandated, and diligently prepared their athletes for the Games. When the rulers of status quo heard about the upcoming Olympics, the lawmakers wanted the status quotidians to win big. They were proud of their country, and besides, they were all up for re-election, and they needed to show that they could achieve great things. So they passed decrees that proclaimed the importance of the Olympics to status quo. And they passed laws and regulations requiring teams to win gold medals and to use the latest in equipment and technology. They invested big time in paper implementation. Of course, the future Olympians had to be selected, but they couldn't pay them much, and they were an egalitarian country. So they said anyone could be on the team. They selected athletes without regard to basic skills or any screening for commitment to the Olympic ideals and values. And lo and behold, lots of people declared themselves athletes and were warmly welcomed to training camp. Then training started in earnest. They all sat in a room, watched videos of the Summer Olympics, and were not sure why they were doing that, since they were going to the Winter Games. But they felt inspired by their viewing and motivated to do their best. And then they read manuals and papers about snowboarding, skiing, and skating. But there were hands-on activities as well, because people knew about adult learning principles. And because everyone knew that being a good team player was important, they divided the would-be athletes into groups and gave them gumdrops, spaghetti, and marshmallows, and had a contest to see which team could build the highest tower. And then they were declared to have insight into how to be a team member and nearly ready to win big. But before they could go to the Olympic trials, they had to listen to lectures and pass tests about the history of the Olympics, safety on the slopes, privacy in the locker rooms, and the policies and procedures related to getting Olympic badges, obeying curfews, and how to say hello in 15 different languages. And finally, they got their equipment and read their manuals one more time. They engaged in a lot of process implementation. After all, they had been through a set of creative and rigorous training processes. Then they went to the Olympic trials, and it did not go so well. It seemed other countries had been investing for a long time in getting ready for the Games, and at some expense. They spent money. Not everyone got to be an Olympic athlete. They had selection criteria, even to get to the trials, and a different kind of training that involved practicing the sport and conditioning. And they had people called coaches who were experts in their sports. And coaches and athletes had a lot of data about how they were doing compared to the best. And they studied new ways to train and play, went through rigorous training to learn the basics. They practiced, watched videotapes, tried again, and they got better and better over time. They engaged in implementation for performance. So the status quotidian athletes returned home disappointed. The legislators blamed the athletes and said that sports just didn't work in status quo. The citizens blamed the legislators, and the athletes quit sports in frustration and went to work at Starbucks. So, what does this have to do with the action we need to take in the next 10 years? Well, like the status quotidians, we too need to learn to invest in implementation for performance. But aren't evidence-based programs and practices all about implementation for performance? Well, as it turns out, evidence about what works can help us choose which programs to adopt. However, the evidence about effectiveness will not help us implement those programs and implement for performance to ensure positive outcomes for children and families. What do we know about investing in implementation? What investments pay off? The science related to implementation clearly tells us that providing reading material, And training alone, no matter how well done, will not lead to implementation of high-quality, sustainable programs and practices. Training and written material may be necessary, but are far from sufficient for high-quality implementation to occur. We need to invest in implementation for performance. What's the point of knowing what works if you can't or won't change the behavior of practitioners, providers, funders, and policymakers? Our behavior must change to create, support, and sustain implementation. Before we can help our children change, we must change. Families, youth, and advocacy groups can help invest in implementation by asking questions about implementation of practitioners and service agencies, like, have you been specifically trained to carry out this treatment? Will it work for me? Who's coaching and supervising you to do a good job? How do you know they're qualified to be your supervisor? How is your work evaluated? Do you typically achieve high fidelity? They may look at you strangely at that point. And families and youth groups also need to be involved in asking implementation questions of providers, funders, and policymakers. How do you intend to support high-quality implementation over time? How will I know that when this person leaves, the next person that takes their place will be as good? Service providers must invest in implementation by ensuring that selection, training, coaching, staff and program evaluation are all focused on producing high-fidelity implementation. And they must invest in implementation by aligning organizational policies and administrative supports with new practice requirements. Providers must make it easy for practitioners to try new approaches and must provide the leadership that insists on high-fidelity implementation and data-based decision-making. State and federal departments of mental health and substance abuse and funders like Medicaid Authority must invest in implementation. You know, we're perfectly willing to invest in building roads and have it take 10 years because we can see the steamrollers, the gravel trucks, and the endless traffic delays, but we know that road is getting built. Well, state and federal governments must also understand that there's this implementation infrastructure that has to be built if you're going to create and sustain high-quality programs. At state and local levels, the federal and funding agencies must plan collaboratively with families, communities, and providers to select the programs and practices. But most importantly, they must be willing and able to fund the thoughtful exploration and buy-in needed to start up the activities and this infrastructure that allows you to select, train, coach, and evaluate the providers who make a difference. They must be willing to strip away accumulated administrative plaque. I love that vision. Strip away accumulated administrative plaque that is built up over the years in order to allow actual implementation to occur. You'll have to create these innovation zones that will actually allow people to do what they want to do. Universities and federal research initiatives must invest in implementation by teaching the science and practice of implementation along with content areas, and by funding implementation research to improve the science of implementation. We need to invest in implementation. We need to change our behavior first in order for children and families to benefit.